Hi, my name is Dr. Natasha Hastings, owner of Athletic Edge Physical Therapy in San Diego, California. Today I'm going to be talking about pelvic floor strengthening and diaphragmatic / 360-degree breathing. This is extremely important, not only for women expecting postpartum, women with diastasis recti, but pretty much for male and female, so we can center our whole body and learn to lift things and be just more in tune. So first we're going to talk about 360-degree breathing. So if you don't know what diaphragmatic breathing is, it's essentially breathing down in here and all the way through your back. That's 360 degrees. A lot of us are chest breathers. So when I chest breathe, you could see my entire chest comes up and my shoulders. Now, this leads to a lot of neck tension, shoulder pain, impingement, bicipital tendonitis, because we already do a lot of things forward in our day, but if you add on chest breathing on top of that, that's going to tighten all these important muscles here, including your scalenes, your pec minor, your SCM. So it's very important that we learn diaphragmatic breathing, and that's what I'm going to do in this first video, is just cover the breathing sequence. So our diaphragm is a muscle that is under our rib cage right here. And as you inhale, air comes down through our lungs. Our diaphragm contracts and opens up down this way and allows air to come down. And then as you exhale, it relaxes and recoils and pushes the air out of us. So I'd like you to first just practice putting your hands on your lower rib cage, and you want to make a C shape so it's going around to your back as well. And you're going to practice 360-degree breathing. So just gently breathe in, let your diaphragm open up all the way down, and let the air fill all this area. Now, if you have been experiencing pelvic floor sensitivity or have pelvic floor tightness, please be cautious with this, because this can increase your symptoms. And even more reason to practice breathing more circumferentially here instead of just here. All right, so we're going to practice 3 big breaths. In and then out. Your stomach should go down as you breathe out. In, breathe into this area, out into your back, and then out. One more time. Good. Okay, so now you have an idea of what that is. So the first exercise, before we start going on to other things, I'd like you to grab a pillow or a yoga block, something to support your head. So I'm going to have my yoga block here, and I'm going to make a C shape with my body. So it's important that we're curling up, because it'll take out the tension in your abdominal area and really let you start to feel that expansion in the 360-degree area. So whatever side you're on, you're going to take your hands and you're going to put it on between your lower rib cage and your waist, all right? And we're going to start with that 360-degree breathing. So go ahead, breathe in deep for me. Feel the air expand in your front fingers and your back, and then exhale. Let the hand come down. Good. Now this time, I'm going to have you take your hand, you're going to really place it on your lower rib cage. And as you breathe in and expand, you're then going to apply. As you breathe and expand, your hands are on your lower rib cage. You're then going to apply a slight downward and in pressure as you exhale. This is just going to help glide the ribs and encourage them to go the correct direction as you're exhaling, and it encourages air to come out. Breathe in. Exhale, let the ribs slide and glide in. Now, some people may have some back tightness or rib tightness. So what you can do is now keep your hands there, apply a slight pressure on the rib cage, I want you to inhale and expand in that 360-degree area, but hold the ribs down. That way we're really encouraging air to go in the back and all these surrounding areas to stretch out the structures. Good, hold those ribs down. You can even C-shape more if you're having trouble with this to really feel it in the back. Good. I encourage you to try that on the other side as well to feel differences. Okay, now we're going to progress from sideline and we're going to go into a supported squat. If you feel okay in an unsupported squat, then go for it. I'm going to take my yoga block here and I'm going to sit on it, or you could have a slight stool or a chair, and you're just going to come around, you're gonna hug your knees, and this is gonna be really good, especially for people who have tightness down in their mid to low back. Okay, so I'm gonna start, I'm gonna hug my knees with my left hand. I'm gonna C-shape now, so we're progressing from the ground to seated. C-shape, curl over. And I'm gonna place my hand on my low back. Now the hand on the low back is especially for those who have pelvic floor tightness. That way you can really get a cue of what 360-degree breathing into your back is. All right, so I'm gonna breathe in, C forward, and exhale. Again, I'm breathing in, making sure my hand is moving back here so I can really get that stretch and good 360-degree breathing. All right, I'm gonna switch sides just to see what the difference is. Okay, now we're gonna add one more thing onto this. If you wanna really increase that low back stretch, mid-thoracic area, I'm gonna come over to my couch. You can be by something heavy, something that's not going to move. I'm going to grab, I'm gonna get a little bit closer actually. I'm gonna grab the underside of my couch, that thing's not moving, and that gives you extra stretch through here. So it allows for more air to expand. Again, I'm gonna do that same idea, breathing into that 360-degree space. You might even feel a stretch up into your shoulders and your rib cage. Again, if you want to try it unsupported, you can do that as well. So I'm just going to hold the edge of the couch. Inhale, expand through that 360-degree space, pelvic floor, your back, your lower rib cage, and everything. Great, well, thank you for your time. I hope you enjoy those beginner diaphragmatic exercises and tune in for the next part.